Thank you. I want to thank the sponsors. It is a privilege to be here, to have the opportunity to talk to you about a whole variety of issues around mental health, which I think, as you said, not just is an important issue in our state, is an important issue in our country. And specifically with reference to Medicaid, Medicaid provides medical services to many of the people who are suffering from mental health because there's such a coincidence of mental health issues and poverty. So the fact that we are getting more Medicaid dollars to our states because of the Affordable Care Act and the expansion of Medicaid, I think is a step in the right direction. But we do need, and I do agree with the idea of expanding the emphasis on evidence-based mental health as well as all health care. But the ability to give the states the opportunity, to give providers the opportunity to treat their patients with the protocols, with the services, with the treatments that we are seeing make progress. And not only this is expanding Medicaid, but I also believe we need to take it a step further, and as we work with the National Institutes of Mental Health, put more of an emphasis on treatment and therapy so that we're taking care not just the long-term research, but the short-term treatment of patients as well. So I would support putting more dollars into treatment, more dollars in evidence-based treatment, and giving states the ability to use that in ways that will help.
And substance abuse crisis, which affects both urban and suburban districts, communities across the 10th Congressional District, just as it does throughout our entire state and country. What will you do to bring bipartisan solutions to this crisis? What specific policies and federal interventions are necessary to address the crisis?
So I think the opioid epidemic we're seeing take hold across the country is something that is affecting communities, every community. I suspect there isn't anyone who doesn't know someone or some family directly impacted by the opioid epidemic. It's affecting all ages, it's affecting all economic groups, it's affecting all races. It does not discriminate. The fact that there was a step taken in Congress this year to move forward in a bipartisan way is an important step, but it's not enough. As President Obama said when he signed the bill, we still need to work to make sure we provide the funding. If I get to Congress, I will support the President's call to bring forward $920 million of increased funding to address the need for treatment, the need for prevention. I think if you look at the top of the ticket, the difference in programs, Hillary Clinton has a very clear program where she talks about 5 pillars of dealing with the opioid epidemic. Number 1 is prevention, working to reduce the incidence of dependency on opioids. Second piece of that has to be working on treatment and getting more people into treatment if they are becoming or have become addicted. A third piece is extending the capacity of first responders and others to have access, fully funded access, to naloxone so that they can have it. Most deaths from heroin and other opioids happen when people are alone. If we can get the first responders the resources of naloxone to bring these people back before they pass, that's a big step in the right direction. But it's also dealing with the aspects of how are we treating people who have addictions, who are using drugs. It is such in this country, has become such a major component of our criminal justice system. Most of the young people in Cook County Jail are there waiting trial, young, of color, poor, waiting trial because they can't afford to pay bail, and they are there because of nonviolent drug offenses. Rather than imprisoning them and leaving them to essentially suffer from whatever conditions they might have, whether it's withdrawal or other mental health issues or physical issues, we need to be getting these people into treatment and giving them the chance to overcome their challenges and become full functioning, fully contributing citizens.
Thank you. Your time is up.
Well, as we look at the opioid epidemic this week.
Thank you. Mr. Schneider?
Thank you. So I too think we need to do more in the area of parity. The Affordable Care Act made the law of the land that we would have parity in spending, but it didn't necessarily give us parity in quality of services provided. We need to make sure that insurance plans aren't just providing parity for treatment, but that the treatment they're providing addresses the needs people have. It's not enough to say, well, we're giving this for asthma, we're giving this for mental health, and you get it. It needs to be, you're getting what you need. So part of it is making sure that we extend and expand what's offered in mental health by the Affordable Care Act. We can't afford to repeal the Affordable Care Act. It's not perfect. We have to build on it, fix some of the problems. But we have to, within the Affordable Care Act, make sure what we did with respect to mental health is not a final step, but a key step forward. It's crucial that we also have, as Mr. Dole said, that we are training our doctors. It's not just providing parity so we have more physicians going into mental health, more providers going into mental health, therapists. We've got to make sure that people can afford to go to school and not be graduating with extraordinary debt from med school or whatever school they choose, and then not be able to find a job because they can't provide the services. Making medical education affordable, making opportunities to find jobs and take jobs in communities that would otherwise not have providers and use that to pay back debt. These are things we can do that can expand and increase the access people have to mental health services, which brings parity into reality, that we really are treating over a lifetime mental health issues.
Those who now for the first time have access to mental health services. Yet nearly 30 million Americans have no access to health insurance or care, including roughly 1 million people here in Illinois. How would you use your standing in Congress to ensure that everyone has health coverage and access to mental health care?
Thank you. As I said before, the Affordable Care Act was a great step forward, but it was far from perfect. We need to work to fix the problems, build on what's working, what can't fix, find new ways to do it. But some of the things that are crucial within the Affordable Care Act in the arena of mental health, it brought $500 million more to mental health treatment. It allows young people to stay on their parents' insurance plans to age 26. At a time when most mental health issues manifest in the late teens, early 20s, that extra ability to stay on the insurance plan becomes crucial. It means that if you have a pre-existing condition, you're able to get insurance. You don't have a lifetime cap, and we've already talked about the parity issues. We need to work to expand it. There are issues with the Affordable Care Act. We have to address those issues. We have to focus on what I believe 4 principles. Number one, addressing the cost of delivery. We're spending in this country 1.5 times per person on healthcare compared to other developed countries without getting necessarily better results. But while addressing the cost, we also have to work to constantly increase the quality. The third pillar has to be addressing risk. Some of the decisions made in the years subsequent to the Affordable Care Act passing broke the risk pools, made it difficult for insurance companies to stay in. That's why we're seeing some of these problems. We have to address the risk component, and we have to work to expand the reach. With the Affordable Care Act, we have 20 million more people with insurance. Among young people, the percent of uninsured has gone from 32% to 19%. That's a huge step forward. But we can't stop until we've expanded that reach so that everyone in this country has access to quality, affordable health care, which includes mental health care. As far as using my standing in Congress, how do you do it? I think the most important thing we have to do is stop the partisan bickering. It's been 6 years since ACA passed, and you've had both sides screaming from the edges. We need to find people in the middle who can work together, who can work to address the challenges, identify the needs, and find solutions that will work with technology, work with providers, work with hospitals, to say, how do we, as the richest nation in the country, make sure that everyone in this nation has access to the quality, affordable health care they deserve?
Thank you.
Thank you. I may have anticipated this question in my last answer, but there are 4 aspects, as I talked about. It is managing cost, addressing quality, expanding the risk pool, and expanding the reach. We have to do all 4 of those things. But how do we address bringing down the cost and maintaining the quality? I think Mr. Dole hit it on the head. It has to be innovation. It has to be policy that is dynamic, that will move as healthcare moves. We passed the Affordable Care Act in 2010. We have spent as a nation, Congress has spent as a nation, the last 6 years fighting amongst itself, while healthcare has continued to proceed forward. One of the things I addressed when I was in Congress was a tax on innovation. I worked with my colleagues on both sides of the aisles to try to lift that tax. We need to work to make sure that we have new ways to deliver healthcare, to get the outcomes we want, in particular where we can to find cures. Again, Mr. Gold talked about the need to work on Alzheimer's, Parkinson's, some of these diseases, asthma, diabetes, some of these diseases we are seeing the costs continue to go through the roof, as we need to invest more in research to find ways not just to maintain lifestyles with these diseases, but try to find cures. If we can find cures, we can bring the costs and improve the delivery. How do you do that? I think you find agreement with me and Mr. Gold here as well on expanding our investment in innovation through the National Institutes of Health. We need to lead the world on technology. We need to lead the world on creativity. We have some of the smartest scientists who are leaving this country because we're not funding the research here at home. If we expand that, if we increase what we invest in NIH, we keep those smart people here in our country and start to tackle the real innovation we need to bring our healthcare costs down.
I just ask a follow-up question to both of you to make sure that as an amendment to the current Affordable Care Act, I'll ask you first.
So I think you're hearing more and more conversation about public option as insurance companies are leaving some of these individual marketplaces. I do believe we need to have competition because competition promotes creativity. But I also think we need to look at what's happening in these marketplaces and see if there's a role for public-private partnerships that can provide some of that competition while providing the access to insurance that people need.
Mr. Dole?
Thank you. I do agree that the more we can inform our young people, the more they understand, the better outcomes we have. And I do believe this is a role where the government can play a part by providing resources, helping develop the curriculums, helping develop the tools that will allow these young people to understand some of the issues. But it's not just around mental health. I tell a story. I grew up in the 60s, and down the street was a family who had a child with Down syndrome. I met him once when we first moved in the neighborhood, and then he was sent away. My children went to school here in the 90s and early 2000s at a school where kids with Down syndrome and other mental and physical challenges were fully integrated into the school. My kids saw these other kids as their peers, as their friends, but they also understood the challenges. All of the stigma that went with mental health or Down or other conditions when I was growing up doesn't exist for my children because they just see these other people as people. The more we can invest into our schools and communities and help young people appreciate each other for their differences rather than dividing them, separating them, I think the better it is. As I touched on before, we know that most or many mental health issues manifest themselves in high school and college in those early 20 years. But I think by taking away the stigma, by teaching people that this is not a sign of weakness, this is not something you deny or ignore, but reaching out for help is a sign of strength. That there are people who will join with you and help you through a difficult time. We can make mental illness not a stigma to our people, but mental illness just something like getting asthma or diabetes, something they live with and they deal with and they get the care and they can have full and complete lives. And I think working in the high schools is a key piece of that. And in Congress, I will promise to work to try to bring more of those programs into our schools.
Thank you.
John Schneider.
Is this easier to hear?
Yeah.
All right, good. So I agree with Mr. Dole. Passing this legislation is important. Had I been in Congress, I would have been one of the 420. But we also have to pass, I took it off. We also have to work to pass more legislation. We already talked about mental health parity, to make it parity in quality, not just parity in dollars. I want to work on legislation like that. We've talked about the opioid epidemic. I want to help push President Obama's plan. He's called for $920 million additional spending to promote therapy, to work on prevention. Right? We can't just talk about these problems. We have to actually invest the dollars to address these problems. And in Congress, I will work as best as I can, working with people on both sides of the aisle. I think what you see in Congress among Republicans and Democrats are people who understand when people are suffering, when others are suffering. I think the most important thing I can do as a member of Congress is working with my colleagues, Republican and Democrat, to say this is the impact of the legislation we're talking about. Working on educating, working on explaining, and working on showing how we can make a difference, how we can pay for it, and how by taking these steps, we're actually, in many cases, going to be lowering the cost we'll have to spend later on in life as we're helping people deal with mental illness at a young age and learning to live with it, rather than dealing with the adverse consequences of young people in prison, young people taking their own lives, the negative consequences of trying to turn our back on these problems.
Thank you. There are at least, in Cook County Jail, there's at least 2,000 people with serious mental illnesses, and perhaps 10,000 in our state prison in Illinois. And of course, this is true both in the federal system and across the country. What will you do to reduce the number of people with serious mental illnesses who come into our criminal justice system and end up in prisons and jails?
This is a crucially important question. Today I had the privilege of attending a lunch in Waukegan for a group I'm a member of called the Coalition to Reduce Recidivism. I have spent the last several years understanding this issue better, talking to people who have gone through the prison system, who have failed to get the help they need. I tell the story of a young man, Larry, we were talking about this earlier today downstairs, who spoke to our monthly meeting. And he talked about working his way through high school in the projects in Chicago, graduating high school and actually getting into college. And he was able to do that because of the investment of time, energy, and love of his mother, making sure that he stayed on track and having the support he needed to get through high school. When he got to college, he talked about the stress and the anxiety of being in college. And as he's telling the story, I'm listening and thinking of my own kids, and I could identify, he started self-medicating to deal with the stress. Self-medicating became drug addiction, and drug addiction became criminal activity. And criminal activity led to essentially the next 15 years in prison, in and out of prison. And he finally got himself clean at age 35. He was talking to us at age 45, talking about the support he got because he finally got the treatment he needed. You are right, we have far too many young people in prison for nonviolent drug offenses, many of whom are suffering from mental health issues and unable to get the support or therapy they need. And it becomes a vicious circle. We need to work at intercepting these kids before they get into the prison system, into the justice system, giving them the opportunities. We need to reform our justice system in general so that these young people who can't afford bail, so they end up spending 6 months, 10 months, a full year in Cook County Prison or other similar prisons, jails, waiting for their trial, falling further behind, losing the opportunity to integrate into our communities. We need to, instead of putting them in jail, we need to start putting them into therapy programs, into treatment programs, giving them the resources they need to have a second chance to get an education, get work, and continue on to the rest of their lives.
Thank you.
Thank you. And just to build on that, from fentanyl, we're seeing carfentanil, we're seeing the deadliness of the drugs these people are using going through the roof, and the burden it's putting on the entire system, the first responders, the justice system. We need to work at the source, and I think part of the problem at the source is overprescription of pain medicine. There are a lot of pieces to this, I believe. Part of it is, and many of you in this room understand this far better than I do, but we are requiring doctors to spend less and less time with their patients, more and more time on other things. They are trying to get to the solution as quickly as they can. Oftentimes the patients are demanding it, and it's easy to write a prescription for painkillers. But to work with patients to deal with pain, to do the therapy, to take perhaps a little bit longer, but hopefully a little bit more successful pathway to managing the pain without the risk of addiction that follows. We need to give our doctors the ability to do that. And I think that's one of the things working within the Affordable Care Act we can strive to do. There's too much prescription of opiates. There's no question about that. We need to try to bring that under control. I do think the federal government has a role in that. The pharmaceutical companies have a role in that. I think this is a case where, again, working public-private sector, working in a bipartisan way, we can work to address the problem at its source, prevention, therapy, and then dealing with the consequences afterward in a more humane way.
Mental illnesses. What supports would you encourage to increase meaningful employment among people with mental illnesses? And what changes, if anything, in vocational rehabilitation programs or federal funding for those would you support?
Again, a very important issue, because someone who has mental health challenges, who then cannot find employment and is left alone without the resources, you begin that vicious circle, the vicious spiral down. Whereas if you take someone who does have challenges, is able to get therapy, is able to get on track and find a job where they can earn a living, find housing, whether it's fully supported housing or partially supported or just sustainable housing, where they can actually deal with their concerns and take step by step to move forward becomes crucial. I think the role the federal government can play starts in a lot of different aspects. You talked about job training. Providing and developing programs that will work at the skill sets of people at different levels of abilities is crucial. Something I worked on when I was in Congress. In fact, the first piece of legislation I introduced, called the America Works Act, was working on manufacturing, but there are pieces of that we can take to work in other areas to help people find jobs commensurate with their skill sets by providing them the skills commensurate with their abilities. It has to be investing in housing, giving them the ability to have housing that gives them the resources they need. Whether that, I had dinner a few weeks ago at a fully supported housing facility in Highland Park. When it is full, there will be, I believe, 30 people living in this home. Having someone there 24 hours a day, but living in their own private apartment. Some are 2-bedroom apartments, so they'll have a roommate. But having independence, having the confidence to go out and work together. I don't have to tell you in this room, in Illinois, we leave people basically adrift after a certain age, and it's up to the families. I think there are things we can do with the tax code, with other resources, that as a government, we help all those families. Because we all know there, but for the grace of God, go I. The stronger we are as communities, the stronger we are helping each other, the better our communities will be, and the more we can accomplish as a nation's home in Highland Park. And if not for the community coming together and a few very generous benefactors, this home wouldn't be in existence. I had dinner with 6 young people and 2 professionals who were there. There are professionals in this facility 24 hours a day. This is an opportunity for these young people that was extraordinary. Unfortunately, it's an opportunity that's denied far too many other young people here in Illinois and across the country. What's necessary is, I believe, more investment into housing for people, whether it's with mental illness or intellectual handicaps, whatever their challenges are, providing these opportunities. Providing resources for the people working in these facilities to make more than a minimum wage. One of the people I talked to is making $10 an hour. He's doing it on the weekends because it's what he loves, but he can't do it full time because he's got another job to pay his bills. But the only way we do that is we come together and address this problem as a country, as our communities, working together, making sure it's not a partisan issue. Because again, mental illness doesn't choose between Democrats and Republicans. Mental illness affects all of us, and it affects our communities. But as I said earlier, I believe if we invest in supporter housing, if we invest in therapy prevention, or therapy intervention, so we're preventing people going into our criminal justice system, all of those investments will pay back far greater dividends by not having to have young people in Cook County Prison. It costs $54,000 a year to keep a young person in Cook County Jail. As a father of 2 college-age kids, that's what it costs to send a kid to college. But when they're in jail, they're not getting the experience, the lessons, the skills that they need. But if they can be in a supported housing environment, they can have opportunities to get educated, they can have opportunities to work, they can have opportunities to live a full and complete life. And I think that's what we need to invest more in.
Thank you. Would you support expansion of Medicare coverage for substance abuse disorders?
Absolutely. And let's talk about Medicare coverage for our seniors. We are seeing more and more seniors, we talked about this before, being overprescribed painkillers and becoming addicted to their medicines. Right? It's not their fault that this is happening. They're not asking for it to happen. We need to provide them the treatments to overcome this addiction and get back on with their lives. So yes, absolutely, I would support that. It is something that I think will allow Illinois to bring more services, more care to people who desperately need it. And as you've seen over the last year and a half, as a state in Illinois, we have seen a budget impasse. We're now a year and a half without a real budget in place. Who's suffering the most? It's the people who are with the least, the people who are in many cases having not just mental health issues, but economic issues, other health issues, and they're getting squeezed. I think all we can do to help address these issues, we should be doing, and I will work for it as well.
Thank you so much. Mary,